Hi, my name's Lindy Royer. I am the creator of the Master System and founder of thenaturalback.com. Getting permanent back pain relief is a complex process. It's not something that happens overnight, and there is no magic bullet. There are, however, a lot of things that you can do to get relief right now. Step number one is to find a comfortable position. And by comfortable, I mean a position where you can feel supported, either lying on your back, sitting halfway up, or lying on your side. Some people are also comfortable lying on their stomach. The most common positions that are comfortable for back pain relief are lying on your back, either with pillows underneath your upper thighs, your knees, and your lower thighs, or lying in what we call a 90-90 position with the legs either up on a coffee table, a chair, or the edge of a couch. These positions usually place your spine in much less stress and help to reduce tension in your lower back right away. In order to do a few things at once, you're going to multitask in terms of back pain relief. I first want you to either get an ice bag or make one for yourself. Lots of people have probably heard about using peas and corn and that kind of thing to substitute for an ice pack. That's perfectly okay. It's not really that comfortable on your lower back, however. So there are quite a few commercial brands available that are fairly easy to mold to your spine. These work just fine. An even better version, in my opinion, is something that we call an ice slushy. And this is something that you can make on your own at home. It works really well. You can use it again and again, and it only costs you a few bucks to make. All you'll need is some rubbing alcohol, like this, and some water, and a couple of Ziploc bags. Make sure you get the heavy-duty bags that can seal really well so that they don't leak. And I suggest that you double bag it. I'm only going to use one bag here for demonstration purposes, but I recommend that you use two. And you can always replace the bag on the outside. So what you're going to do is you're going to take your Ziploc bag, you're going to take 1 part rubbing alcohol and 3 parts water. Now I've pre-measured mine. So you're just going to pour the rubbing alcohol or the water into your Ziploc and pour the water in. Like so. And then you're going to seal up the bag, get as much air as you can out of the bag, and then seal it. You'll take your bag and lie it flat in your freezer. Find a spot where you can lay it fairly flat and leave it there overnight. When you take it out the next morning, it should be quite easy to mold this bag to your lower back. And as I said, you can use it again and again. Next, once you've got your ice bag together, you're going to find a position where you are in the least amount of muscle tension. This might be sitting semi-reclined, it might be lying on your back, it might be lying on your side, it might be lying on your stomach. Whatever the position, look around and figure out where you're going to rest for about 15 or 20 minutes. If you're lying on your back, which is the most common position for most people, you're going to be probably the most comfortable with your legs in what we call a 90-90 position. This is with the shins parallel to the ground and the upper thigh bone in a vertical position. This would be with your lower legs supported maybe on the edge of a chair, on a coffee table, on an ottoman, edge of a couch, something like that. This tends to put the spine in the least amount of spinal compression. The second best position for most people is to have a couple of pillows underneath the lower legs. One pillow is in the upper part of the thigh, one is from the knees to the lower part of the thigh. If you're just putting one pillow under your knees, it's not enough support, so look for 2 pillows. Other options are lying on your side with a pillow between your knees, or lying on your stomach with a pillow just underneath the front of your shins at the lower part of your ankle. Whatever the position, gather up everything that you need to get your head, your neck, your lower back, and your legs comfortable. get your ice pack together and figure out where that place is going to be. Once you've found your comfortable position, you have support in the way of pillows, and you have your ice pack together, you're going to be in this position for about 15 or 20 minutes, really working on decreasing muscle tension. Muscle tension is one of the primary reasons for back pain. So therefore, reducing muscle tension is going to give you back pain relief. You're going to use a technique or a concept that I call mental spinal decompression. The easiest way to reduce tension in your back is to notice your breathing. When you're in pain, your breath tends to get shallow and rapid. So the breath goes into the upper part of your lungs, eliminating breathing into the lower part of the lungs, and also decreasing the amount of oxygen that's circulating through your system. This is going to further constrict your tissues and create even more tension. So begin to notice your breathing, and just by observing your breath, you'll find that you can slow it down. The more you can slow down your breathing, the more deeply you can breathe, the easier it's going to be to decrease muscle tension and therefore create decompression in the spine. Once you've iced for 15 or 20 minutes, take the ice pack out, and if you haven't been on your back already, put yourself on your back if this is comfortable. You're going to do just a little bit of spinal movement. This can be things like rocking the pelvis forward and back, rocking the pelvis side to side, rocking the pelvis around in circles. Whatever's comfortable, just do a little bit of movement in the lower back before you then get up. Remember that the effects of ice last about 2 to 4 hours, so you only need to keep ice on, especially if you're using a good icing technique, for about 15 to 20 minutes, and then leave it off for 2 to 4 hours. In between times, try and do some kind of spinal movement in the form of pelvic rocking for about 2 or 3 minutes every hour. Things to avoid in the first 24 to 48 hours of an acute back pain episode are heat, hot tubs, and too much spine compression in the form of bending or lifting. If you're taking over-the-counter medication, be aware that sometimes these medications will mask your symptoms. So keeping your spine in a more balanced alignment, even if you're not feeling pain, is going to help to increase your healing time. I hope you've enjoyed some of these tips and techniques. I look forward to hearing from you. If you go to our website, thenaturalback.com, there's a section there for entering our blog. Please let us know if these were helpful. Thanks for watching.